Did you know you had this little hole, this condition before any of this happened?
I had no idea.
A hole in her heart. Coming up on today's All Things Heart, a married couple, both doctors dealing with a diagnosis that had their worlds colliding.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Here's what we're talking about today. It would seem like the very definition of a heart problem, being told you have a hole in your heart. You're about to meet a local woman who experienced a startling symptom that led to the diagnosis and her husband's connection to the very procedure she needed to treat it. Plus, did you know 1 in 4 people has a hole in their heart? How to know if you're among them? We will tackle that as well. And as always, we love your questions and comments. They're the very heartbeat of every episode, so feel free to connect with us right now. We are on YouTube, Facebook, and the All Things Heart email. We're everywhere. You can find all those links right here on your screen. We all have a hole in our hearts before we're born. And for 75% of us, it closes up in those first few months after we're born. That wasn't the case for Dr. Deanna Tadros. She had no idea until one very strange evening. To understand the bond between Dr. Peter Tadros and his wife, Dr. Deanna Tadros, you have to go back to their college days when they were just 2 fresh-faced students far from home.
There's a story there, obviously.
There's a big story.
And a young Peter did something pretty gutsy.
There is a dance at Rice where the girls ask the guys. And so I, in my typical brazen way, asked her to ask me. and
I had no clue.
Yeah, she had no clue.
I thought we were just friends.
Yeah.
She shot him down, but that only made her more intriguing to him. And by the end of senior year, he'd worked up the nerve to ask her to one of his dances. This time she said yes. 3 decades, 2 medical degrees, 2 daughters, and 1 sweet dog named Finnegan later.
Finny is as close to being a stuffed animal and still being alive.
Dr. Tadros and Dr. Tadros have built a beautiful life, one that came with quite a scare in April of 2022.
We were in the kitchen talking, just regular conversation, laughing, and all of a sudden, I couldn't speak. Being the physician I ran into the bathroom and I looked at my face to look for facial droop.
Classic physician, she's sitting there trying to self-diagnose, which is what I would do too. So,
They can laugh about it now, but at the time it was scary. Ultimately, she was able to write down what was wrong, and they headed to the ER at the University of Kansas Health System.
As soon as we got in the car, I called and activated the stroke team.
Emergency department, this is Stacy.
I was diagnosed with a patent foramen ovale.
Also called a PFO, it's a little hole between the top 2 chambers of the heart that closes up in most people after they're born. That didn't happen with her heart.
So a small clot had crossed, then traveled up the carotid artery, which is the major blood vessel up into the brain, and then lodged in a part of the brain that controls your speaking, basically.
It was in the ER that all of their worlds collided at once, because Dr. Peter Tadros is actually an interventional structural cardiologist. His specialty, treating PFOs.
And one of the crazy things about this whole thing is he actually was one of the first people in the region to start doing this procedure.
Yeah, so this is one of my areas of expertise.
He helped write a paper on this.
It's very weird.
Was there any part that crossed your mind where you were like, I know how to do the PFO closure, let me do it?
No. One of my partners, Eric Hochstead, I asked him to do that.
There was added pressure, if that's even possible. Dr. Deanna Tadros is also close to Dr. Eric Hochstead.
In residency.
He was my supervising resident when I was on an internal medicine, so I've known Eric for a long time.
All 3 doctors together again, but this time under circumstances they never could have foreseen so many years ago. Wow. And we are thrilled to have the whole band is back together. We have Dr. Deanna Tadros with us today, along with her husband, Dr. Peter Tadros. We also have emergency medicine doctor Chad Cannon, who was there that night, and the doctor who performed her PFO closure, interventional cardiologist Dr. Eric Hochstad, who joins us virtually. Thank you all so much. First of all, Dr. Deanna Tadros, how are you feeling today?
I'm feeling great, thankfully.
What's it like to see your story told like that in retrospect?
I just feel so blessed to be okay, and to have been in a situation where I was taken care of very quickly.
And surrounded by experts. I want to go back to when you couldn't form words. Was that your only symptom? I mean, you could think what you wanted to say and they just wouldn't come out of your mouth?
Yes, that was my only symptom. It was very strange. We were having a conversation, and all of a sudden I just couldn't get the words out.
Wow.
And I checked, looked in the mirror to make sure I didn't have facial droop, because something was wrong. And I opened a book and I was understanding what I was reading. But when I tried to recite it, I couldn't recite it. So I said something to Peter. At first he thought I was joking around.
Right.
And then he could tell, no, I wasn't joking. I was able to write things down. I was able to completely understand.
So
I
did you
just
write
could
down,
not. Yes.
I can't speak?
Yes. But I could not. I mean, it was garbly when I spoke.
Okay, so you're sitting there, you're in the kitchen standing having a conversation. Deanna, Dr. Deanna, takes off. You don't think anything of it. You don't know she's in the bathroom trying to self-diagnose herself for, God forbid, a stroke. So at what point did you realize, oh my gosh?
Well, I saw she was trying to speak to me, and she really wasn't. And I was like, are you joking? I thought she was joking around. We were talking about another issue.
You guys are always joking around.
Yeah, exactly.
You're a couple that's filled with laughter, right?
But, and then I realized, no, she really can't speak. And then I said, you can't speak. And then she wrote, I can't speak. So then I knew, okay, well, we had something really serious going on. She had a thing called expressive aphasia, which is one stroke symptom where you can't speak. You can understand, but you can't speak.
This gives me the chills, and not in a good way, when I'm hearing this, because I'm trying to think about how you felt, because as a doctor, you're such a good doctor and you always stay calm and collected, but when it's happening to the love of your life, did you feel a whoosh of panic in that moment?
Yeah, I mean, you feel extremely concerned, for sure.
Yeah.
You're very worried. So, we popped some aspirin and we're like, let's go to KU. So we
said a prayer.
Said a prayer, and then popped in the car and then got the stroke team going, and that's where Dr. Cannon came in and was instrumental in getting things going. So.
And that's what I want to bring in Dr. Cannon here. So when you get the call from Dr. Tadros, activate a stroke team, what does that look like when a stroke team is being activated?
Sure. So he called on the phone while he was driving in, and he quickly told me the story, and I immediately knew this was very concerning. So I paused, activated our stroke team, which consists of sending out a message to a multidisciplinary team, including a stroke neurologist, a stroke nurse. It activates emergency. I happened to be working that day, so emergency physician, emergency nurse, a pharmacist. We notify the CAT scan tech to be ready, and we also notify the radiologist so they're ready to read the study. So it's really a big operation. A lot of folks notified. And
at what point did you regain your speech?
I think as we were driving into the emergency room, it's about a 30-minute drive, and it was improving. And by the time we were actually in the emergency room, it was pretty close to normal, but clearly something had happened.
Right, something alarming. And then Dr. Hochstad, ultimately you performed the procedure on your friend and your partner's wife, who's also your dear friend, so no pressure, right?
Yeah, no pressure. It was a really unusual experience. Actually, Peter called me on the way to the emergency room because he's very responsible, and he didn't call me saying, oh my gosh, my wife's having a stroke. He called to say, I'm in the cath lab today. Can you cover? I can't really come in right now. And I asked him what, he sounded kind of funny. He said, what's wrong? And then he told me the story.
Wow. And so you now have the job of closing the hole in Deanna's heart, and we're going to show our audience some animations of the procedure. But could you talk us through this procedure and what you do and what you did for Dr. Deanna Tadros?
Sure. This is showing a wire going across what is the PFO. It kind of goes quickly, but that's the delivery catheter for the device. As we advance it, it flattens out into a disc. And then we can pull that disc up against the wall and then deploy the other disc on the right side. And if we like it, then we can lock it in place. And that shows a little hoop that locks the catheter, the device. And then if we really like it, we can let it go. And then over time, it gets covered with scar tissue or endothelium and really seals the hole nicely.
What are those discs made of?
Polyurethane, they're a fabric,
Okay.
and then just wire for framing.
So from start to finish, how long does it take to perform the procedure?
It really only takes about a half hour to 45 minutes for a typical procedure. You do run into different challenges depending on how you do it. And this is actually, this is, I guess, one of the Gore's images of the same device. That's what we see under X-ray on the right.
Okay. Okay.
And on the left is the delivery catheter.
Is it possible, Dr. Tadros, to live your whole life with a PFO and not have any problems?
Yeah, it is actually. The majority of patients, as you mentioned in the beginning, it's 25% of the population have PFOs. The vast, vast majority of people never live in their whole life, live and die, don't realize they have a PFO.
So any 1 out of 4 of us, well, standing in this room.
Here's 4, right? Here.
So you're the 4 here. And then if when you're watching this from home or the office, I mean, look around you. There are 1 out of 4 people probably have a hole in their heart that didn't close up. Is that?
Yeah, it's kind of a remnant. It's almost like a normal variant. It's a remnant of that fetal circulation.
Okay.
So just because you have a PFO doesn't mean that something imminent is going to happen. And I think the other point is that, you know, she clearly was having a stroke. There's many causes of stroke, so it wasn't until later that we knew that it was the PFO.
And it's something you specialize in, which is so weird. It's another element, another layer of the onion.
Yeah.
What did you think when you found out it's something that you've written papers on, you've done research on, you specialize in treating?
Well, it's a very weird feeling that your wife is suffering from the condition that you treat people, and now that she's gone through this, it's a conversation I can sometimes have with patients who are unsure about proceeding forward with. I can say, well, do you believe in this? Do you think it's the right thing? I say, well, matter of fact, my wife had the same thing, and she went through and she had the procedure, and she has done well. So,
what a great story to be able to tell your patients.
Right.
And if you trust enough. You trust your partner to perform this procedure on your wife, so your patients are going to feel like it's going to be reinforced they're in great hands.
Yeah.
Dr. Cannon, so when someone comes in having a stroke, do you immediately scan them for PFO, or is PFO as a reason for it rare?
PFO is really rare. I believe it's far less than 1% of strokes are caused by this. And in this case, even when someone comes in with isolated expressive aphasia where they can't speak, the cause of that is usually not a stroke. It's often something else like psychogenic, hysteria, a conversion disorder. And I recall asking if you guys had been in an argument or something else could have been going on that led to this.
It's a response to something emotional, typically?
And then when they said no, and they told recited the events, I said, no, this is very concerning for a stroke.
So I have a question for you. Her symptom was not being able to speak, and then she could speak. So the reason she couldn't speak was because the clot had lodged in the part of your brain that controls speech. Where did it go next for her to regain the ability to speak? Was this clot just traveling around in her brain?
I don't think we know for sure, but I think likely it dissipated and dissolved.
Okay.
And the body has mechanisms to dissolve.
Right. And she got some aspirin therapy right before. The aspirin may have contributed to that.
Boy, that's good.
Yeah.
What'd you say?
Immediately at home.
Immediately.
Yeah.
So that would be advice. Would you give our viewers if you start feeling something like that? Is there any risk to just taking 2 aspirin right away?
Obviously, we're medical experts, but in general, if we're really confident about stroke, that would definitely be a good thing to do.
Right.
Yeah.
To take that. Wow. So one of the things you learned also during all of this, Dr. Tadros and Dr. Cannon, was that Deanna had suffered a silent stroke even earlier. What's a silent stroke?
So a silent stroke basically is discovered on imaging tests, and again, that's what she saw. In a different part of the brain, there was evidence of an old stroke in the balance center of the brain, but it was small enough that it didn't cause any symptoms. So silent means a stroke occurred, but you're unaware of it because there's no symptoms.
And so looking back, by the very definition of it's silent because you're unaware of it, do you have any memory of one day having a weird dizzy spell or anything? Do you know when that might have happened? Any indication?
Really, I don't. Of course, I try to think back to when it could have happened. I got dizzy on a ride at Universal Studios, but
Right.
you know, nothing that I could
Who
pinpoint.
doesn't? Yeah.
Yeah.
So that's kind of alarming. How many people might have a silent stroke in their lifetime and not realize it? Is there any tracking for that information?
I don't know that we really know that information, Chad. I don't think there's really any data for that. So,
wow.
But it did confirm that this was likely an embolic or a blood clot because we saw strokes in 2 different distributions in the brain.
Holy moly.
The thing with the PFOs is that, you know, it's almost like a diagnosis of exclusion. That's the cause, because so many things can cause stroke. You know, you want to make sure, and PFOs are so common, the background noise denominator is so high that you want to make sure that there's not something else that's going on. And that's where Dr. Cannon came in and was rapidly evaluating her for all these other potential causes.
Dr. Cannon, how rare is it to have a friend and family member or colleague's family member or spouse in the ER when you're there for what you do?
It's not as rare as you would hope.
Really?
It happens, and you know, when I've been here for 20 years, I know a lot of folks in the city and in the institution. So it does add an extra challenge to take care of folks you know or your friends and family, and you have to be really careful that you still ask difficult questions and you do a thorough history and exam so you don't miss anything.
And Dr. Hochstad, how often is it that you are performing these procedures? Is it a daily basis? Weekly?
No, it's not daily. It's probably every couple of weeks. It's becoming more and more common as the rest of the medical community starts to recognize that this is an important cause of strokes in people who have no other risk factors.
I want to ask one more question before we get to the community questions, because we have some great questions from our viewers. Dr. Deanna Tadros, you had said something that I've always remembered from our interview. You said you felt so grateful that this happened at this particular time because the only reason you knew was because you were trying to speak. Whereas if you'd been on a walk, alone, reading a magazine, sleeping, you wouldn't have known that this blood clot had lodged in your brain. I mean, that's really, it is lucky.
Right. I actually, looking back, I felt very blessed that it happened when it did. Peter was home, and I was awake, alert. I knew that something had happened, and the fact that, you know, as we said, I'd had a silent episode prior.
Wow.
It's just so important to get it taken care of. Mm-hmm. And so the fact that I had symptoms led us to the emergency room, led us to the diagnosis, led us to the treatment.
And so grateful that you guys were led to each other decades ago. I mean, you married the guy who was the expert on what you had wrong in your heart.
Yeah.
I also want to just make a comment about, you know, as you know, I've obviously experienced being a doctor for patients who are evaluated by the stroke team, but as a family member of a person who was evaluated by the stroke team, it's pretty amazing to watch how coordinated it is, how rapid it is, how the communication. I mean, it was, you know, it was very heartwarming to realize I was part of this KU community that really did an amazing job in evaluating her.
And we always have patients saying it's like a family when they come in here to be treated, and it's like family treating family. I want to get to some of our community questions because we have already gotten several of them. Kip has a question. He writes, if 1 in 4 people has this hole in their heart, how do I find out if I have it? Is there any preemptive testing we should be doing is what I think Kip is asking.
Yeah, and Eric can answer it as well as I can, because he's also an expert in PFO. You know, the bottom line is that they're very common, and the vast majority of people never have an issue with their PFO. And when they've looked at the data, epidemiologic data, to see does it really increase your risk overall if you have a PFO, the answer is really no, because the event rate is so low.
Oh, interesting.
So if you know you have it, you still don't really do anything with it. So because it's such a rare cause of stroke.
And you just answered Eric's question, because Eric was asking, our viewer Eric, should you get it closed if you aren't having complications?
Yeah.
And you and
the answer
Dr.
is no,
Huck
because then
said
you'd be
no.
closing 25% of the population.
And for heart procedures. you'd be
Yeah, so
awfully
it'd be
busy.
like if you went to Arrowhead Stadium, 15,000 fans out there have PFOs.
Oh, that's a good way to put
You know,
it. Yeah.
and so they're living their lives not even realizing they have it. Because again, it's more like a normal variant than really a, congenital heart disease.
Corey has a question. Corey wants to know, is this genetic? Do you have any idea?
Eric, do you want to comment?
Eric,
I can
Dr.
also
Hochstad?
comment.
Yeah,
too.
I don't think it really is. I think both Peter and I have had families where more than one person has a PFO. But as far as I can tell, there's not a strong genetic link.
Yeah. And I would agree with that, just because again, this is, everyone has, 100% of us have this as part of our normal fetal circulation.
Right.
So it's really more, the fact it doesn't close is really more like a variant of the process.
Kim Bosley Moore just wrote in, one of our Facebook viewers. Kim wants to know, Dr. Deanna, were you having any symptoms before this happened to you at all, when you look back on that day?
Nothing. It was as if, like flipping a switch. I was speaking at one point, and then our next part of the conversation where I was going to say something, I couldn't say it. It was that quick.
Oh, that's wild. Sharon Chapman Whitelaw has a question. She wants to know if an echo will show a hole. Will an echo show a hole?
Yeah, that's how
It
it's
will.
diagnosed.
So
is
that's it,
with the
okay.
echo, yes.
Okay. Wendy has a question for Dr. Deanna. She writes, what happens now? Any follow-up medications, appointments?
Oh, yes. I had a follow-up echo, I think it was like a few months after the procedure, just to double check, and everything was fine. For 3 months after the procedure, I was on dual antiplatelet therapy, which was like a baby aspirin and Plavix. And then after 3 months, I stopped the Plavix. I'm on a baby aspirin a day. That's it.
And that's it.
Mm-hmm.
And did you feel, after the procedure, did you feel tired, sore, anything like that? What was the recovery like?
The recovery was not, the recovery was fine. I had to be a little careful because they go in through the groin, so you have to be careful with the incision site. And then I think for the first few months I couldn't do any, like I couldn't play football, which wasn't a problem.
Or
football, roller derby.
Right.
No, but seriously, I didn't water ski, and we were in the mountains, like we didn't do any four-wheeling or anything like that. But,
did you find,
normal.
were you treating her like she's made of glass, like she's an ornament or an eggshell?
I was trying to be cautious.
I bet that'd be so stressful.
He was so sweet to me.
Oh,
He was
love
so
that.
sweet. He took such good care of me.
I just love
Gotta keep
that.
it going.
You guys take care of each other. That's really beautiful.
So Alexis,
Yeah.
I have one comment about the testing and the echoes.
Yeah.
It's actually a special part of an echo. If people have had echocardiograms in the past, we may not see a PFO. We have to do something where we agitate saline and inject that. So we have to be specifically looking for it on an echo. Otherwise, we often won't see it.
Okay, that's a really good point. I want to keep our whole panel up here now for some final thoughts because this is such a special program. Dr. Deanna Tadros, I want to start with you. By nature, you said you're not really big being in front of the camera. However, you really wanted to get this message out to the public. So what's your message to people watching?
My message is, as a patient and a physician, if you're having unusual neurologic symptoms, things that you can't explain, please see your doctor. And if you have a PFO and they recommend that you close it, I would have no qualms about having it done again if I needed to. It's just for peace of mind too. I know that hole isn't there anymore. I know that a clot can't go through and cause a stroke. So I would just highly recommend you if you're having symptoms or episodes, get it checked out.
Call these guys.
Absolutely.
Have a neighbor like Dr. Peter Tadros or Dr. Cannon or Dr. Hochstad. No, I mean, that's really a good message for anyone watching. Dr. Tadros, what would you like our viewers to know?
I think one is that, again, PFO is a rare cause. I mean, even though it's so common in the population, so just because you have a PFO, you shouldn't live your life in fear that you have it. It's only when you're looking for causes of stroke that we really want to focus on it. And then two, I think the real message, if you have any type of symptoms that are suggestive of stroke, you need immediate evaluation. You need to go to a stroke center. I mean, that's really the key because, immediate treatment can result in often, limiting disability or not having any disability from your stroke. And stroke isn't always just, having the droopy face. It can be you can't speak, you have balance issues, those things. So it's important to get that evaluated immediately and not wait.
Dr. Cannon, you're nodding your head. Yes, absolutely.
I agree. You really need to listen to the symptoms, and even if you happen to be stubborn or you would like to, finish your day doing something else besides going to the emergency department, listen to your instinct. And if your loved ones are concerned and you happen to be stubborn, listen to them. And because every minute matters. Time is tissue, and this is stroke is a real time-sensitive disease, just like a heart attack.
And Dr. Hochstad, in all your medical training, in all the bonds you form in med school with the people you work with now, is it surreal to be here telling this particular story with this particular patient?
Yeah, it is a little bit surreal. I remember when Peter called and said what was going on and he's worried she was having a stroke. I don't know about Peter, but my brain immediately went to PFO because she's young, she doesn't have other risk factors. And my next thought was, oh dang, he's going to call me. And he did. And we both looked at the echoes and confirmed there's a defect, and I was honored they asked me to do it.
Oh, that's wonderful. We're not done with you yet because we know our surgeons and doctors do amazing work inside these hospital walls. We know that. But what are they like when they're not saving lives? It's time to do this.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
I told you there was a reason I was looking for personal pictures, so we're going to kick this off going behind the mask with Dr. Eric Hochstad. First of all, you have an adorable family. Who's this in this picture?
Thank you. This is my wife, Mary, and then my oldest daughter, Kelsey, and her husband, Eric, my youngest daughter, Gracie, and then my middle daughter, Laura.
And where are you here?
We're at the U.S. Open. We're celebrating Kelsey's birthday and had a family reunion. My middle daughter, the daughter at the far end, lives in New York City. So as part of that celebration, we all went to the U.S. Open.
That's a great shot. Okay, now let's go to Lake of the Ozarks. What's your favorite thing to do at the lake, and who are you with here?
I'm with some really good friends that when we first moved to town, we became lifelong friends. That's Steve Castor in the foreground. Terry Fields is next to me. And then starting on the far left, that's Jerry Fields and my wife, Mary. And, we don't go to the lakes often, but we love to go. It's just beautiful to be there, and we enjoy being on the boat or tubing or going hiking. It's just a beautiful place to be, a great place to relax and connect with friends.
Oh, you deserve to relax once in a while. So now it's time to play a little game called Where in the World is Dr. Chad Cannon? Dr. Cannon, we know you love to travel with small children to exotic, far-off locations. That's a hat trick right there. So where is this trip? We're going to start closest to home with this one.
This is in Park City, Utah, which we travel and ski there every year.
Mm-hmm. And who's in this picture?
That's my wife, and then my boy-girl twins, Max and Emery.
How old are your twins?
They're 16 now, so this is a few years old.
They're driving now?
Very scary.
So you have twin new drivers in the house. I bet your insurance is sky high.
Very high.
Yeah, that's no fun, right? And next up, we have a picture from a bit further away. China. How old were your kids when you went to China?
Oh, they were probably about 8 then. Yeah, this is on the Great Wall of China outside of Beijing.
And then from China to Machu Picchu?
Correct, yep.
Tell us about your philosophy in traveling everywhere with your kids, because it's really neat.
I think traveling, you learn a lot of life lessons that you don't always learn in school. So we've actually taken our kids out of school at times because we feel like being exposed to others and culture and foods is a really valuable experience. And
beautiful.
We have great memories.
And what's on your bucket list after the Great Wall of China?
I think I want to see the Great Pyramids and Petra.
Oh, that'll be neat.
Yeah.
Talk about a field trip. Now we want to head to the Tadros family. We know your love story. We also know you guys love to travel. So let's take a look at some pictures you shared of a recent trip of a lifetime. You went to Israel? Is that where you went? Tell us about that.
It was wonderful. We had been planning this trip for actually a couple of years. It was canceled once for COVID. We went with our church. and we traveled all around the Holy Land, and it was very inspirational. It's
beautiful.
Wonderful.
We love seeing your pictures together. I bet that's a pretty neat adventure. Do you have anything next on your bucket list? You also have 2 daughters who are very accomplished.
That's Petra, by the way.
That is Petra.
Petra, okay.
Yeah.
That was Petra.
Sea of Galilee.
Yeah. That's beautiful. And your daughters, are they also doctors? No. One's a doctor and one's a philosopher.
They were not interested in medicine.
Right. One's a biomedical engineer who's working for a nonprofit designing medical products for low-resource countries.
Wow.
And she's down in Houston. And we have another daughter who's graduating from college this year and headed to law school, who wants to be an environmental lawyer to deal with energy inequity.
We call that a power family.
It's all from the mom. It's all from the mom side.
Oh, I love that. Well, thank you so much for sharing a bit of your life with us and your journey. Thanks for taking the time to be here. We really appreciate Dr. Cannon, Dr. Tadros, Dr. Hochstad. Thank you, and we're so glad you're doing well. Just a beautiful story.
Thank you.
And thank you for joining the conversation today. Coming up next week on All Things Heart.
I think it's okay to ask for help, and it's okay to reach out, to not kind of suffer in silence.
Every woman will experience menopause. No way around that. But did you know it can affect a woman's heart if it hits too early? You'll meet a woman and her doctor who took extra precautions to lower her future risks based on what they saw in her past. That's next Thursday morning at 10 a.m.